This documentary was made to highlight the story of good healthcare that our Calabria is able to offer and implement, and excellence that has become a model to follow. For years, healthcare professionals have been working in collaboration with companies to create innovative and reliable care pathways to ensure the best care, even in extreme emergencies, a great challenge that has been successfully met. On Monday, the 9th of March 2020, we are in the midst of lockdown. Hospitals are inaccessible, and it is difficult for heart patients to access normal care pathways. However, Calabria reacts in an incredible way, and the cardiology referral centres start an innovative telemedicine service that guarantees immediate answers to the most fragile patients. Remote monitoring.
Durante il periodo della pandemia Covid,
during the COVID pandemic period, any patients who could not intervene to hospital could not be seen for periodic checks, as the hospital was off limits for that period. But thanks to remote monitoring systems, we had the possibility to enter the patient's device to check the vital parameters of the patient.
Questo ci ha permesso di capire.
This allowed us to understand their effective optimal clinical conditions and to intervene with any medications by phone, thus advising patients with the best strategy.
Sono Federico.
I'm Federico, a medical student and son of a patient carrying a defibrillator that has changed our lives. One morning, I sent an email to Bianchi Melagrino Morelli Hospital in Reggio Calabria, as my father needed technical support from the cardiology department, since his monitor seemed to be faulty. I was promptly contacted by the head doctor, Dr. Benedetto and Dr. Pangallo, who solved the problem. Unfortunately, after a few days, they noticed the presence of a red alert, high priority, and thanks to this, I was contacted immediately. We did a phone interview in order to get detailed information about my father's health status, the medications he was on, and the type of symptoms he was presenting. Following the investigations, the doctor suggested changes in the drug therapy and which tests needed to be performed in the upcoming days. The following week, the database detected an automatic transmission which revealed a risk score related to the average THF. Thanks to this monitoring, the doctor's intervention and technology, my father's symptoms are constantly improving, and together with the doctors, we were able to monitor a situation that is now regular. Thanks to all this, my father's symptomology has disappeared, and I wholeheartedly thank the doctors who were there for me with the help of this incredible technology. What would have happened without remote monitoring?
Sarebbe stato un disastro per tutti.
It would have been a disaster for everyone, both from the patient's psychological point of view and from the practical point of view of not being monitored for 6 months, 8 months or a year, where there could have been unexpected deaths for these patients, which could have been avoided. Implantable devices, valuable indicators. Patients with devices are very complex, as they can often have acute symptoms. For example, we are talking about decompensated patients who have the possibility to be followed with these new technologies from a clinical point of view, as we can predict an episode of acute heart failure, as these devices are equipped with a series of algorithms that allow us to predict a possible flare-up of heart failure even 30 days before the event itself occurs. What was the state of mind during lockdown?
Ci siamo trovati impreparati di fronte alla pandemia.
We found ourselves unprepared in the face of the pandemic. That is, we didn't expect such a serious situation, so dramatic, with such a sudden development. And so we had to organize ourselves in a short time in order to continue to care for our patients who could not come to hospital.
Non capivamo cosa stava succedendo realmente.
We didn't understand what was really happening at first. There were so many people who didn't believe the news was true, but we saw that something was wrong. The problem was that most of the patients were terrified, So we found patients who didn't come to the hospital even though they had chest pains, and consequently they died at home because the fear was so great, the fear of getting sick, getting infected and dying, as they saw on TV. So they avoided coming to the hospital at that time, and so many young people died, and so many patients with heart attacks died at home.
È stata una grande paura.
It was a great fear, first of all for us operators. We didn't know what to do. You come to work fearing to take the disease home, so it was heavy. Not so much for ourselves, but for our loved ones. And the sick often decided not to come to hospital.
Ho avuto un rapporto continuo.
We immediately had a continuous relationship with the area doctors, and our organisation won over the northern regions. We won there where others have failed. Telecardiology, cardiology, emergency and territorial integration, a unique model to imitate.
L'Organizzazione Mondiale della Sanità
The World Health Organization defines telemedicine as a mode of care that finds its strength when distance is a critical factor.
sono un fattore critico.
I like to say in a simpler way that telemedicine, telecardiology in particular, has the concept in moving information, not patients.
Telecardiologia e pandemia.
Telecardiology and pandemia. I believe that in the period of the pandemic, telecardiology became an object of interest as it solved so many problems. During the pandemic, data was published regarding, for example, acute myocardial infarction, where, in many parts of Italy, hospitalization decreased significantly. Hence, the number of infarctions decreased. But the number of infarctions didn't effectively decrease. It was just the number that decreased because people didn't go to hospital for fear of the pandemic. Instead, we published data a little bit against the trend, in the sense that because our telecardiology system is such a widespread proximity system, our data was against the trend. What we did was to compare the pre-pandemic data with the data during the pandemic and saw that the requests for electrocardiograms, especially for emergencies, decreased. However, heart attacks did not decrease. And what was the explanation we gave? Since telecardiology has become so much a part of a doctor's culture, people were afraid to go to the hospital, but they called the ambulance to perform an electrocardiogram at their home, and therefore heart attacks in reality did not decrease. They remained at the same number as they were before the pandemic. University between science and innovation.
La tecnologia oggi è indispensabile.
Technology today is indispensable to make quality medicine. We're in a great revolution. Cardiology has always been among all branches of medicine, the one that sees more to the future. It has always been a speciality that has seen much attention to innovation. Artificial intelligence will enter in an important way in clinical practice. Just think that it is already there for some technologies, such as for breast cancer and heart failure diagnosis. Today, we have systems that allow us to make the diagnosis independently from the doctor. Remote monitoring multidisciplinary tool.
È importante anche la collaborazione fra branche specialistiche.
Another important factor is the collaboration between specialist branches that have points of contact and boundaries. Cardioneurology, for example, is a field in which we have ventured in the last 3 years, which is also participating in national and international studies. Here, we try to understand some symptomatologies as they occur with neurological phenomena that have, however, cardiological issues. And then the osmosis of information and the passage of patients from one branch to another. Therefore, a complex vision has allowed us to discover that some neurological pathologies often underlie cardiac pathologies. Heart failure and innovative therapies.
L'evoluzione dello scompenso nell'arco degli anni.
The evolution of heart failure over the years has been rapidly implemented both pharmacologically with innovative therapies and electrically with the implantation of devices appropriately harmonized within a system and synchronized with the left ventricular function. New diagnostic pathways between medicine and biomedical engineering.
Le nuove tecnologie rappresentano un caposaldo.
New technologies are a fundamental cornerstone for us to be able to approach our work better. COVID certainly brought many negative events, but it also brought a deep reflection on the implementation of new technology, because only in this way were we able to overcome the critical phase with as little damage as possible.
Le nuove tecnologie rappresentano per gli ospedali italiani
The new technologies represent for Italian hospitals a great opportunity, but also a necessary reality. And to this end, our skills and physicians are certainly fundamental. However, another figure is increasingly flanking our figure, which is that of the biomedical engineer. Then the clinical engineer who supports us in our choices, in decisions, in understanding these systems that are increasingly sophisticated, but they also facilitate our work. However, they have algorithms of operation that can be better interpreted and decoded by an engineer. So the physician of the future is a physician who is increasingly insisted by the figure of the engineer. This documentary was created in order not to forget, to make it clear that investing today is essential to be well tomorrow, and above all, to thank each and every health worker who, with great personal sacrifice, despite the critical conditions of the Calabrian health system, has ensured the health of so many sick people. And then, thanks to all the doctors, nurses, engineers, technicians, the companies in the field who did not spare a moment of their time, risking their lives during the difficult period of the pandemic, to believe in their mission. We hope that the long journey of human, professional and technological growth can become a new and fascinating journey, and that it does not remain just a distant memory. From our Calabria, not everything that appears is as it seems.